Welcome everyone to this very special National Pathology Week 2020 launch event, Meet the Presidents. It's good to be here virtually to hear from the Royal College of Pathologists President, Professor Joe Martin, and the College's President-elect Dr Mike Osborne. I'm delighted to be the host for this evening's online launch. My name is Nicola Hardman. I'm a consultant medical microbiologist based in Calderdale and Huddersfield NHS Foundation Trust Hospital. Just to give you a little bit of background about myself, I completed my medical training in Sheffield before moving to Leeds for specialist medical microbiology training, and then on to a consultant post at CHFT, where I lead on antimicrobial stewardship. I enjoy training and education and was invited to host this event after attending the college's public engagement training last year. So to explain a little more about how the event is going to work, we're first going to hear from both Joe and Mike about their career path and their thoughts on this year's National Pathology Week theme, Pathology at the Heart of Healthcare. I will then ask them both a few questions to follow up on some of what they cover in their introductions. And for the last 15 to 20 minutes, we're going to be taking questions from yourselves and we'll put them to Joe and Mike. So please put those questions in our Q&A feature on Zoom. The National Pathology Week team will be helping to manage questions. And between the three of us, we're going to ask Joe and Mike as many as we can. So moving on to Professor Joe Martin's slide. I'm now delighted to introduce Professor Joe Martin. She's currently the RC Path President, as well as Professor of Pathology of Queen Mary University London and Honorary Consultant at Barts Health NHS Trust. Joe is a histopathologist by training and has a subspecialist interest in neuromuscular disease of the gut and renal pathology. Joe was National Clinical Director for Pathology NHS England from 2013 to 2016, and she started her role as President of the College in November 2017. As she demits office, she's taken up role as National Specialty Advisor for Pathology for NHSEI. Over to you, Joe.
Thank you so much, Nicola. Good evening and welcome. So I've been asked to talk very briefly, luckily, about things that I've done previously. And I trained at Cambridge in the Royal London Hospital, did my FRC path. And then over the years, I've done a PhD, and my PhD was actually neuropathology based. And I ended up for a brief while as a professor of neuropathology, even though I'm not actually a card-carrying neuropathologist. My PhD was on the cellular pathology of motor neuron disease, and I've done a lot of neuromuscular pathology, which is sort of morphed into my interest in gut neuromuscular pathology subsequently, which has been quite fun. Done quite a lot of clinical management, leadership, and I've really enjoyed working with a wide range of the different specialties over my career, so it's been quite fun. If we go on to the next slide, I was asked to talk about pathology at the heart of healthcare. And absolutely, I think very few people realise that our 17 specialties include veterinary pathology, and that's Nelson the Golden Doodle top left. But pathology, for me, it's with you from before you're born. So our reproductive scientists help conception, and they help in prenatal diagnosis as well of genetic disorders, right through to autopsy pathology and after death, and encompassing absolutely everything in between. As you grow up, you've got pathology with you the whole time. So even if you're not conceived with the support of our reproductive scientists, you'll have metabolic screening in 6 weeks after you're born. As you grow up, if you have trauma, you'll have our transfusionists supporting you. As you catch all sorts of various germs and diseases, you'll be supported by the microbiologists, the virologists, all the clinical biochemistry, the hematology. All of that makes our profession, and across all our different disciplines, completely fundamental to our whole life. And that's why I think pathology is at the very heart of healthcare. Thank you.
Thank you, Jo. That was lovely to hear. And we'll have a chance to talk further about your career and your thoughts shortly. But before that, we're going to move on to Dr. Mike Osborne, who's our President-elect of the college. Mike will become our 20th President on the 19th of November at the 2020 AGM. He works as a consultant histopathologist for North West London Pathology at Imperial College Healthcare NHS Trust London, where he's also the clinical lead there. His working time is divided between gastrointestinal histopathology, bowel cancer screening, postmortems and teaching. He runs a BSc in Humanities, Philosophy and Law at Imperial College. He's currently a member of the RC Path Council and is chair of both the college's Cellular Pathology Specialty Advisory Committee and Death Investigations Committee. Mike, it's over to you for your slides. Thank you.
Thanks very much, and thanks for inviting me today to come and have a chat about pathology. So my career basically is, so I went to medical school at Guy's and St Thomas's hospitals, UMDS, which is the University of London. I qualified from there in 1995, and during that time I did an interconnected BSc in experimental pathology, where I basically did some experimental stuff on gastric cancer and early precursors of that. When I left, there were you couldn't get a job as a pathologist as a trainee. It was one of the times when there'd been a little bit of a miscalculation about people going into the specialty. But I was one of these people who liked lots of things at medical school. So I went off and did a surgical rotation and became a member of the Royal College of Surgeons in 2000. But just as I was finishing that, training posts opened up again in pathology. So I went and did the Northwest London training post in pathology and became a member of the Royal College of Pathologists in 2005 and a fellow in 2008. So basically now I work at Imperial College London, based at Charing Cross Hospital, where I do, as they said, I do gut pathology and I do postmortems and lots of undergraduate teaching, including running a BSc on humanities, philosophy and law. And as far as the college goes, I'm on the council and I'm chair of the Specialty Advisory Committee on Cellular Pathology. And I also chair the Death Investigation Committee, which basically looks after all autopsy related questions and so forth that's not forensic suspicious deaths. And I was elected President-elect and I start in November. So that's my background. I was asked then about why pathology is the heart of healthcare. Really, I'm just going to reiterate what Jo said. It's hard to imagine that anyone really comes to hospital without having a test that pathology is involved in. Most healthcare interactions depend on tests. Most of these tests are done by some sort of pathologist or pathology-based scientist in some sort of pathology laboratory. And because of that, pathology covers such a huge spectrum of things. It touches on almost every interaction people have with healthcare. And some of these we clearly think of and come to mind straight away. So obviously cancer diagnosis, looking after seriously ill patients, hematology, blood tests and so forth. But every infection people have, even if it's just a minor infection where people go to see their GP, there'll be swabs, they'll go to microbiology to find out what the infection is. Somebody who has a trauma that you might not think has much to do with pathology, but every single trauma case has loads of blood tests. They may receive blood, there'll be transfusion, there'll be cross-matching. Even if somebody unfortunately dies from trauma, their organs may be taken and given to other people. That involves pathology with the matching of the organs and so forth. So all of this, everything you can imagine when somebody's ill involves pathology. But even when you're not ill, it involves pathology. So as Jo said, even before people are conceived, during pregnancy, just think a completely healthy pregnancy, how many blood tests and so forth happen. All of that is pathology. And all through childhood, you have your vaccinations, that's all pathology, immunization and everything. So pathology really is the backbone of everything. And even beyond humans, you've got the veterinary pathology. So even your pets, the animals in farms and so forth, they're all looked after by pathology. So without pathology, there would basically be no modern healthcare. So I really do think it is at the core of everything.
Thank you, Mike. That's super. I think you've both really got across there just how wide-ranging pathology is, and just, you know, day to day, both in health and in disease, it's critical to our healthcare systems. And I'm sure everybody's found those introductions really interesting, and we've already got some questions coming in. Before we hear from the audience, I've got a few questions for you both, actually. So it'd be great to hear a bit more about your background and career paths, and also your thoughts on pathology within the wider healthcare system, and in particular, you know, how it's impacts on COVID-19. So firstly, you're both histopathologists. You've already touched a little on your introduction about why you've chosen histopathology, but what might you say to medical students and foundation doctors who are considering histopathology as a specialty?
I would say go for it.
Okay.
Absolutely go for it. It's not just histopathology, but any of our disciplines. I would absolutely say go for it. It's a fabulous career. It's a fabulous career. You learn something new every day. You learn you work with amazing people, and just the whole process of pathology is just fascinating.
Yeah, I completely agree. I think pathology is a really good career option. And I think the thing is, lots of people don't think about it because there's a reduced amount of pathology in lots of undergraduate teaching. And a lot of people, in hindsight, as they get a bit older in their medical careers, quite often people say, oh, I really wish I'd thought about pathology. And the fact is, there are so many pathology specialties that you will find something that suits you. So there are hugely patient-centered ones. For example, the specialty you do, Nicola, you know, the medical microbiology on wards, and they're moving away. They're obviously still patient-focused, but they don't have the direct patient contact that some people are less keen on. So there is absolutely something for everybody in pathology. So I would recommend it for any training.
Thank you. I've got to agree with you. You know, it's an absolutely superb specialty. We're really privileged, and we do touch, you know, as you've said, we've got a real breadth, haven't we, in terms of how much patient facing we may be, but also we touch so many specialties. So actually, I personally feel privileged. I'm part of so many teams day to day. You know, 1 minute you're involved in surgical queries, the next minute medical. You know, we get the best of everything. I think we're in a great specialty. So now let's imagine for a moment that we've got the ability to time travel. So what words do you give yourself as, you know, as a trainee or as a junior doctor, if you were able to go back? What words of encouragement, advice, something that you perhaps know now that you wish you'd known back then? Mike, would you like to go first this time?
I would say that the best bit of advice I was given was just to take all the opportunities that come up, even if they don't look like something that you might immediately go for, because that way, particularly when you're an undergraduate and a trainee, you may come across a branch of medicine or pathology that you didn't expect, and you think, wow, this is absolutely for me. But the other thing is, you meet loads and loads of people who can be really useful for you going forward in a way that you might work with them in research. You might have a problem that they're able to help you with. You know, you might just make friends, you know, and also it's just interesting to come across all these different bits of medicine that you haven't done before. So I would just take all these opportunities that come up to do different things.
That's great advice. Joe, what would you say? What would you say to yourself back when you were a trainee?
I absolutely agree. Follow cases that you get because they're always fascinating. Don't be afraid to ask questions. I still do that now. If there's something I don't understand or I don't quite get, there's lots of, very clever and really helpful people around. So ask, keep your sense of curiosity going, and just have fun.
That's perfect. Thank you so much, both of you. I think they're really wise words. So I'm going to now move on to our next question. So as we've all said, pathology is pretty amazing. But if you had to tell us the absolute best thing about being a pathologist, the absolute best thing about your job, what would it be?
It's the people. It's, for me, it's absolutely the people. And, you know, being president has been such a privilege, and it's enabled me to meet even more amazing pathologists everywhere. And just the length and breadth of the UK, internationally, there are just stunning pathologists all over the place. Different takes, different approaches, but all really, really skilled. So for me, it's the people and it's the common purpose to help patients. And I think that for me is what makes pathology so special.
Yeah, I would echo that, to be honest. And like you said, Nicola, it's the fact that because you're doing pathology, you actually mix with lots of different teams, irrespective of which branch of pathology you're doing. And I think that that's really good. So you're a part of lots and lots of different teams, and even almost beyond medicine in some of the things that I've done through pathology, you're meeting people in allied professions and so forth. So you meet lots and lots of people doing lots and lots of interesting, exciting things. That's the best bit of it.
Super. Thank you both for those responses. And so now I'm going to bring us, we've done our time travelling and given ourselves advice. So we're now going to come back to the current time. I'm going to touch on the challenges that we're all facing. So can you talk a bit about the work that you've been doing during COVID-19? How has your life changed? How has the working lives of other pathologists changed? And how do you feel we've dealt with COVID-19 as a workforce? Who's that to go first? Go ahead, Jo. Thank you.
So okay, so my world has changed completely, because I've spent the whole time learning about COVID, learning about all the testing, and advising government and Department of Health and National NHSE, and speaking with international colleagues all about testing, serology, PCR. I learned more about immunology and T-cell immunity than I would ever have been privileged to have come across before. I have spent probably 10 hours a day since February living and breathing COVID, with short intermissions for trustee board and everything else in between. So it's been incredibly different, learning about supply chains. Never thought I'd be privileged to be in the middle of a global supply chain shortage, but there you go. So life has been very different, coordinating, working with superb colleagues like Mike to get college guidance out really quickly, supporting colleagues across the way, workforce, all sorts of odds and ends. So it's been really, it's been completely different in terms of in COVID times.
Super. Lots of change then for you by the sounds of it. How about you, Mike? How's COVID impacted on your work?
So I got, during the first lockdown, I got redeployed to the Nightingale Hospital in Excel and asked to set up their mortuary and their sort of post-mortem bereavement type services, which was it was going back to what I said earlier. I met lots of exciting people. I worked very closely with the Army and lots of other people. It was a bit of a daunting prospect walking into a massive room that was completely empty and saying, in 5 days, we want the biggest mortuary in the country here. Do you mind doing it for us? But I just rung up a few people and they all did amazing things. People like the APT, Association of Anatomical Pathology Technology, the mortuary staff, they were brilliant. They sorted it all out. As I say, the Army, all the nurses and everybody, you just got to meet so many people. And during that time, we did some guidance for the college and so forth. And since that's happened and we had the lull in the summer, going back really to my trust, where we've had to try and catch up with the backlog of stuff that's the cases that couldn't be done in the lockdown. So dealing with all of that is really where I've been doing, which I suspect is very similar to what lots of pathologists have been doing around the country. But yeah, that's.
I'd also like to pay massive tribute to the trainees during this time, because we've Matt and the trainee committee have been amazing. Trainees all over the country, so the redeployment, making sure everyone's okay, and the other thing is trying to deal with the exams. Trying to keep the exams going during this period has been a massive thing, and they have been just stellar in how they've been understanding and helpful, and it's been a real kudos to them for being so fantastic.
Thank you. That's great. We've got some incredibly resilient and amazing trainees. I absolutely echo that. So that comes to the end of the questions that I had lined up for you. So we can now move to our audience's questions. We've had a few coming in. So the first one we have is from an Abby White, and she's asking, how available are trainee positions now? Mike had mentioned they were sparse back in his day. I don't know whether you wanted to.
Okay. Just to avoid confusion, there's lots of trainee spaces now. There's the national scheme. You apply nationally. If you want to apply. It's very open. You've got a very good chance. I don't think there are no places. There are lots of places. We want you to apply. Please do, for all the pathology specialties. What I am talking about was a peculiarity that happened in the late 90s. It affected pathology. It also affected gynecology and obstetrics. It also affected orthopedics. And it's basically where the body that was bringing trainees in got their maths wrong. And they had to shut training programs. That absolutely isn't the case now. We are open for trainees, and we want you to apply for all specialties. So do not worry. That is a historic thing going back years ago when I was a trainee.
That's great. Thanks for clearing that up, Mike. Yeah, exactly. Pathology, numerous specialties within pathology and lots of training places. So if anybody's keen, then they really should apply. So moving on to our next question, we've got Shelley has asked, so she certainly agrees that pathology is at the core of medicine and patient care. She also thinks pathology is the most intellectual and broad-based of all the medical specialties, since you need to know a great deal about a huge range of medical conditions. Would you agree?
Yeah. Completely. Even as a humble histopathologist, not even the giddy heights of microbiology or histocompatibility and immunogenetics. I've got to know about genetic disorders. I've got to know about biological therapies. I've got to know about everything that's current across not only just my field, but across a broad range of other disciplines. And if you're one of the pathologists who touches across different specialties, I have to, until recently, I had to keep up with renal and GI, and that's it keeps your brain warm.
Mike, what are your thoughts? Do you agree as well?
Yeah, I completely agree, and it's equally true if you're a diagnostic histopathologist, because everything changes very, very rapidly, and you have to make sure that you're up to date, because the clinicians obviously expect you to be absolutely on the ball for making sure you give the right characterization, right classification, but also particularly, again, people who work in research. And there's so many opportunities in pathology for research, probably more than in almost any other medical specialty.
Yeah, that's right.
Some of that research stuff that people are doing is incredible. The virology research, all immunology research around COVID and way beyond all of that. So yeah, I think it's absolutely true.
Brilliant, thank you. I know I'm constantly having to learn. It's amazing because you never stop learning. Whichever specialty you cover at a particular time, and as I said before, you'll take one call, from surgery, then medical specialty, then peds. So keeps it fresh, keeps it interesting, keeps you've just really, really fabulous. So the next point is coming from John Boyes. So he's saying, picking up on Mike's point, how can we help promote pathology teaching at undergraduate levels? He feels that often microbiology are given just a few sessions early on. Makes antimicrobial stewardship understanding difficult. I think for trainees, they do need to get that really under their belts quite early on. How do you think we can really push pathology teaching at undergraduate levels?
So I think take every opportunity you can to engage with the students. So taster weeks as well. I never say no to a work experience student or a medical student who wants to get involved. And there are lots of very good resources. We've done a lot at the college around virtual resources for undergraduates as well. And we've got an undergraduate pathology curriculum which is supported by e-learning resources across a range of different platforms as well. So they're on the website, they're on app and various odds and ends. And go out there and get involved with the students. That's the most important thing. Get involved, go teach, go show them stuff. And they respond hugely. It's really important. There's lots of good, very good undergraduate pathology societies around as well.
Mike, is there anything else that you would suggest?
No, I agree completely. Yeah. I think you just have to make sure that the everything in undergraduate medicine has been squeezed, to be honest, because there's just so much more that's being covered now than there was. That doesn't mean that it's a bigger subject, because these other things were always there, but they're just all included now. So I think you just have to take your opportunities to make your teaching as good as it can be, to stimulate people's interest and so forth. When I was at medical school, the undergraduate pathology course was absolutely fantastic, and it was a single course of 2 months. Everybody loved it. Everybody thought it was a high point. Even people who went off to be pediatric cardiac surgeons still said the best thing they did was, nothing against pediatric cardiac surgeons, anyone listening, but they all thought it was the best thing, and it really stimulated people. And I've got people who I trained with who've now gone off and professors of infectious disease at UCH doing pathology-based research and stuff on TB, all stimulated by the really good course we had. So if you get good teaching, people will like it. I think that's the way forward.
Absolutely. I remember, some of what got me into pathology were the teachers and people that inspired you to want to go down that route. So yeah, we're in a really privileged role, and we've got to actually show how good it is and get these undergraduates really interested in pathology, which we've obviously been going on about, is how it's amazing. So I'm just going to go on to our next question. We've got one here. So, does the traditional role of the cellular pathologist have an expiry date?
No, I don't think it does have an expiry date. I guess this alludes to everything to do with artificial intelligence and all of the sorts of stuff that you come across. I think what will happen is that you will start doing, it will remove lots of the mundane screening type procedures. So you can imagine, for example, bowel cancer screening, where you have a lot of low-grade tubular adenomas, simple polyps. It might pull all of those, and so they're not being looked at. But what you will be concentrating on is looking at the really difficult stuff that takes time. And hopefully what it will mean is we're better able to provide a really good service in those areas. So what it will mean is people are moving to the top end of their envelope of expertise, if you see what I mean. So you get more bang for your buck from your pathologist. I don't think they'll be retired and put out to grass. I think that's not going to happen.
No, absolutely with you on that one completely. The tech we'll be using will be completely different. So we'll be, just at a punt, we'll be using scanning mass spec, which will give us different data to the data that we come from immunohistochemistry currently. We'll be integrating that with genomic databases, and we'll be looking at genetic profile. We'll be looking at epigenetic profiles of tumours, and we'll be matching it to databases of biological and targeted pathway therapies. So it'll be even more full on than it is now.
It's just extra, isn't it? We're not going to lose the traditional side of things. We've just got all these exciting new ways of working coming through. So
yeah, I mean, to be honest, I wouldn't mind losing 30 minutes looking for a single mycobacterium on a Zeol-Nielsen stain. I'm very happy to have AI or a decision support finding my little purple curly thing for me. That's a really do with.
Super. And a question that or a point really that's just come in is that somebody that trained abroad in hematopathology, they had very laboratory style training, and have found actually the clinical side of things here, they really worry that they might be diluting out some of their laboratory experience. But I was asking how could people work as lab doctors only here? I suppose certainly from a micro point of view, we have a spectrum, and we have some people that would be very laboratory based, and then some very clinical facing colleagues. And do you find that's the same in histopathology?
Well, histopath and across all the other disciplines as well. So hematology, we've got everything from red cell specialists through to the blood cancer side. We've got transfusion doctors who are very skilled in transfusion practice, and we have straight lab-based and research lab-based practitioners in hematopathology too. We've also got lab-based hematopathologists who are hematology background but specialise in bone marrow morphology and blood smears as well. So the morphological side of the lab based, and that's a career option. In fact, we've got a colleague who specialises in that at the Royal London.
Yeah, I mean, I completely agree that when you histopathology it doesn't tend to have too much patient interaction directly, although some areas of it, for example, cytology, it can be very interactive because some people even do their own FNA clinics and so forth. But moving into the other specialties, your microbiology, virology, immunology, especially because immunology is almost splitting between immunology and allergy, and some very, very lab-based, some very, very clinically based. So in all of those specialties, there is a range, and people can find the niche that they want, which as we keep highlighting, is a peculiarity of pathology, that you can always find something that suits you.
Fabulous. So we've had a comment in pointing out kind of how tricky some of the terminology can be and how much information there's to learn. And do you have any tips, any learning points, any magical ways to kind of get through some of the more difficult topics?
Just immersion. Talk. Go and see your pathologist. Go and talk to them. Really. Read around it. I'm no stranger to Google myself. Google and the textbooks. Wikipedia, use online textbooks as well. So just getting used to it really. And you'll always find things that you don't know. You'll always find words that you don't understand that I have to look up. Oh, excuse me. Yeah. So good fun, but just keep at it really.
Yeah, I agree. I mean, if you can link things to their clinical significance, you can usually remember them much better. So you know, and in all specialties, that's the same, I think, in all the pathology specialties. So, you know, going to MDTs, going to the clinico-pathological meetings for some of the specialties, going to the microbiology meetings and so forth. If you can link what you're learning to the pathology, then and to patients, then you remember it. It sticks much better, I think.
Mostly until the microbiologists find nice molecular ways to characterize their organisms, and they all change names. all the mass spec identification that helps change all the terminology. I think it's all the Klebsiellas, isn't it?
Klebsiella, fungi is another one. We just like to, we like change. I think there's some really good tips there, like, you know, put it in context, really getting into a topic, immersing yourself, and everybody will have different ways. It's about finding your way, isn't it? Finding your way of learning, what works best for you. Fabulous. So this is a lovely question. And this will be for you, Jo. So what is your most memorable time as president?
My most memorable time. I don't think, to be honest, there's not one. I've done, I think the one that I was very privileged to do were the lab tours. And you go and meet people in their own labs. That's been very memorable. Meeting people, seeing their own departments, seeing the way they do things locally. One department's even got its own wax mat, which has got its own hospital crest on it, which I've never seen before. I saw a carpeted lab, which I'd never seen before, and just meeting amazing people. I think that's it, and learning about what they're doing, and particularly from a college point of view, having the privilege of being able to share that, you know, being able to tell, you know, government ministers and the rest of the world exactly how brilliant pathologists are and what they've been doing. And didn't you know that, you know, we screen everybody at birth, and that's pathology, and we've got metabolic biochemists who know like textbooks backwards and forwards and can do amazing things with chemical pathways. You know, that's us. So it's been, I think that's what's memorable for me.
Oh, super, that's fab to hear. We've got another question, which is, I'm going to put this to Mike first, actually. So what is the highlight of your career? What's been the highlight of your career so far?
Wow, that's a difficult one. I think working at the Nightingale Hospital, actually, with all the different, because I just met so many people that even in pathology you wouldn't normally meet, like all the army, and there was you know, management consultants who said that actually it was the most worthwhile thing they'd ever done in all their 40 years as a management consultant, which is quite something to have somebody say when their bonus each year is more than I'll earn in my entire life, probably. So, and it was really good, you know, quite daunting, but I think that was probably it.
Wow, so it's a huge privilege, isn't it, to be involved in such things. So, Jo, aside from being president, obviously, what's been the highlight of your career?
Well, the presidency is obviously you can't beat that. Recently, a fun thing that we've been doing, we've actually been taking rapid testing into care homes. And that's been really lovely because it's been working with students on a research program, a clinical trial, and in a very unfamiliar setting, but learnt such a lot. And again, met residents who just, you know, care homes all across East London, different worlds. So having that particular experience to do that has been a real high as well. That's been going on recently, so that's been fun.
You're muted, Nicola.
Sorry, it's going to happen at one point. I was surprised we got this far along without me doing that. So I was saying it sounds really interesting, and by the looks of things, we've drummed up a bit of interest in histopathology. We've had some questions about, is there any guidance that you could offer to histopathology applicants for this year? Somebody asking, is there anything they can do that would make their application stand out aside from taster days?
Go and meet pathologists. Go and meet pathologists. You can do audits. You can help with projects, small projects. And I know it's time limited. There's lots and lots of poster competitions and undergraduate essay prizes that you can do on the website as well. So do check out the RCPath website. Lots of opportunities to just add a little bit of polish to the application on that.
Yeah, I completely agree. Obviously, things are going to get harder now with the COVID situation, but I think that our website, and there are others around, other allied organisations, that our website's very good, coming to things like National Pathology Week, entering a poster for International Pathology Day. All of these things are absolutely brilliant. Now, normally going to a department, having an attachment would be fantastic. Realistically speaking, you may well not be able to do that this year, and that's fine. It's not going to be held against you because nobody can do that. But if you've, put a poster in for International Pathology Week, you've come to this, you've gone to, various other things, maybe put an abstract of a case report into one of the other organisations, anything like that you can do, really.
That's great. Really, really great advice from you both. Thank you so much. So that's all we've got time for. I'd like to thank Joe and Mike for joining us, for giving us your backgrounds and all the advice that you provided as well. Just to everybody that's listening, just to take note of the free online events that we've got running during National Pathology Week. There's the RCPath Book Club. So tomorrow night, there's going to be a RCPath book club featuring Pandemic Century with the author and an amazing panel of speakers who will discuss what we can learn from previous pandemics in tackling COVID-19. And you don't need to have read the book to attend, so you can still sign up now. We have lots of events for school students, undergraduates and families later on in the week. So please do take a look and sign yourselves or your families up for some of these, or even all of them. We'll send you this flyer after the event. There'll also be a short feedback survey, and it'd be great if you could spend a few minutes filling that in for us. So finally, thanks again to Professor Joe Martin, Dr Mike Osborne for launching National Pathology Week. Have a great National Pathology Week, everyone. Take care and good night.